Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and we're going to talk about some open bite cases and skeletal and dental problems that they have. And people come in with all odd things happening to their teeth. What caused them? If you can find the cause, you can usually do something to get the case settled down and take care of the rest of their life if you figure out the cause and get rid of the cause for it. But you just can't figure it out a lot of times. So let's get going on this young lady, and I'm going to show you. Now this is a deep, high angle case. I mean, you look at the distance from here and the distance from this nose up to the forehead, and this is way too much distance down here. Now if you let this, if this person grows up with this problem, I mean, this would just mess up this young lady's life. It's so, straightening something out, this changes the whole way this person will grow up and marry and what she contributes to society, whatever it is. It makes a big difference if you leave it like it is. Now, everything looks nice from here up. It's fine, but this is too much space. And you watch what we got, the increase in this height of the face in here. And there's a lot of problems with the teeth. And she had an upper central coming in, it just is a horrible looking thing. And here's this pretty little girl with all this wrong. Now her mother was real eager for her to get this corrected, but she thought I ought to be able to do it and overnight, I guess. I don't know what she thought. And this is a tough case, and we started working on it, and their neighbor across there went in, they had just a little bit of something to do, and the orthodontist straightened it up in a year or less than that, maybe or something. And she kept bringing that up to me, and I wanted to just, I don't know what, she didn't look at the complexity of the case at all. So anyway, we went ahead and we worked on her, and we took several years to finish this case. And you can see this is crowded, and we're going to move those teeth around. And as we get them lined up better, the facial height went down some. So we won this case. Now here we use an occipital headgear. That's this occipital bone comes down like this, and you pull this out. If you cut these bars where it depends on where it is on the teeth, and here you pick this up, you can pick up the maxilla back at the back, or you can come up further to the front and pick it up, or you can cut it straight across here and bring it up on the anterior portion of the mouth. In other words, you're picking this up, and wherever you attach that to the teeth, you can raise this part up, or you can pick the thing up bodily, or you can get it in the back and raise the back part up the way it's rigged up there. Now it'll be picking the back teeth up to kind of reduce this height some. Now let's look at it. Now it's looking better. We got that tooth that was sailing off up here way out, and everything got it around, and now the vertical height of the face is getting closer. But we're taking time to do this. You have to kind of wait on this as you go. You got to wait till the teeth come in the mouth and really put them in place. And we're working on the anterior teeth and bringing that down. This is 1974, and we get this lined up pretty good. So you have to start out an early type of case with the children, and sometimes you can do a first phase and stop, and then you can start again when they get all the permanent teeth in. So a lot of times you get started on when you can't stop. You can't get everything in like it should be before the permanent teeth come in. So anyway, we had to band this case up to do this. This was early on when we were having to use bands. And so looking at it from different angles. And now we come in here with this high angle occipital deal working on the headgear. Now this is the headgear tube, goes around like this, and we're pulling up in this area right here to reduce the height of these teeth right here. In other words, we kept them from coming in the mouth far enough, and we kept bringing them back up by the use of this occipital headgear, and it goes in and touches that. Some of these will have a spur coming in and catch it under the archway right there. You can pick the front of the teeth up at the same time. All right, we're working with the headgear, and we got the bite is closed. At this point, you just hardly see the lower anterior teeth, and so you have to wait and get in on the teeth. As the teeth get in the mouth further, you can put something in there with an intruding arch and level those teeth out and everything. All right, we go along for another year or so, and the facial structure is looking almost normal now. And so when you look at it from this angle, it is. This distance is almost the same right here. So we're winning this case. We got some teeth, I think we took some teeth out of this lady, the young lady. And now we're getting the teeth in the mouth. Everything is going good. And we've sacrificed teeth to reduce this height and brought those centrals back in line and lined them all up like this. And the lady kept telling that I needed to get this over. I shouldn't take so much longer, and you just got tired of putting up with her. You wanted to do something to tell her to shut up and give you time to do this. And you're working on a facial structure. Here it's like doing a painting, and you got to take time to do it correctly. So don't be pushing that way. And so we level this all out, and we come in and work on the teeth. And here we've gone from this part down to here, and the facial height has changed almost completely. We worked on this case for about I think it's 8.5 years it took for the difference in the time when we started and when we come in here. This was 73, and I don't know what, surely it wasn't a full 8 years, but this is 82 and 73. So it took a long time to get this done. But we got it done and did it right. And this young lady, the teeth lined up, this is the way it was. And here she is. Now she's in high school, and everything's going good. We've been working on her for a long time. And sure enough, she wins the beauty queen in the class, and that really helped out. And I was irritated with the mother, but the young lady went off to college, and she came back to me and thanked me years later. And she's a beautiful young woman. And she's got a good smile, just a little bit of gumminess to it, but it's totally different. And this is what happens if you can work with somebody. It may take years to do the case right and everything, but don't worry about this time. I mean, you end up with this young lady looking really beautiful, and she'll be this way the rest of her life, or just quite a long time in here. You stay with it. And so I'm going to close out and say have a good year, and we'll get started here and show some videos on these cases that I think the pediatric dentists should be free to do this type of orthodontics. And the orthodontists, they disagree with me. But anyway, that's my feeling. So thanks for watching, and I hope you'll join our channel. And we'll hang up here and I'll say goodbye. But this is orthodontics. It makes a difference in the way a person's life is. And so we'll hang up here.